socket joint, and what happens is that this is sort of the socket part of it, and the ball part it sits inside that, and it's like the tips of my fingers. There's two basic ridges, one on the medial side, which is the inner surface, which is here, and one on the lateral side, which is the outer surface, and so this sits in there like so. And what we're doing is looking down into that joint and looking at those two ridges, and they're called the trochlear ridges. And the lesion, the OCD flap, was on the inner trochlear ridge here. We can also see the inside of the joint as far as the cup part of it, as well as the ridges, and we see some of the ligaments inside the joint. And the main thing that we're looking for is the cartilage here, and this is the cup part here on the side of the cup, and these are the part of the ridges here. So we're looking in the center of the ridge, that's where this dip comes down. So this is one ridge here and one ridge over here, and you can see this little area there. That's the early part of the OCD, or you're seeing the very side of it right there. It's a very difficult joint to get into, particularly in loose-skinned dogs like Chows and Shar-Peis. Because what they want to do is, as soon as you put a needle into the joint, the fluid naturally leaks out of the joint and the whole joint blows up immediately. Yeah. Whereas a normal dog with tight skin, the fluid will come straight out of the skin that likes to pool, so it makes it technically difficult. So it was technically challenging. So here's the cup right here. Here is one of the ligaments on the outside right there, supportive ligament, helps hold the joint in place. And here is part of one of the ridges here. This is the outside ridge, or the lateral ridge, and this is the lateral collateral ligament. And you can see the cartilage here. It looks pretty good. Not a lot of erosion to it, not a lot of loosening to it. Looks pretty healthy there.
Is this Wiley?
Yep, this is Wiley. So this is inside that ankle joint. Look at the next image here, another same place basically, looking more at that ligament. It looks good, it's not stretched. Remember how on the x-rays that ligament, I said, oh, there's a chance maybe that ligament had some trauma to it. Well, that's the ligament, and it looks very healthy.
Good.
So I'm very happy with the lateral collateral. I don't think that's an issue. It doesn't look torn, doesn't look stretched, it looks very nice. So that sort of helped eliminate that from my thought process. Okay, now this is the medial ridge, which is the ridge we're interested in. This is the lateral ridge, and we're coming down. This is the junction between them. So we're moving basically over the top of my finger down to the next ridge. So this is the valley in between them. It's a subtle valley. It's not a huge valley. It's just a dip in the cartilage or dip in the bone. You can see how this joint fits in very, very tightly. It's a very tight joint. There is not a lot of space in the joint, and that's what makes it challenging. Now over here, you can see the cartilage here looks smooth, and here it looks a little bit rough just on that edge there. That's the early part of any erosion to cartilage or any breakdown of cartilage. We call that fibrillation. It doesn't mean that the full cartilage bed is disrupted, it's just that the cartilage surface is a little bit roughened up.
And that's a result from the problem,
yes.
Right?
And so that's what I said to you yesterday. There's what we call a kissing lesion, where that flap of cartilage, which is what we're looking at here, this is the flap right here, you can see the cleavage line running right down the side, that's been rubbing on here. So we get a little bit of a kissing lesion, a little bit of degradation. Now sometimes this is completely stripped off, okay? This is right on the edge of it, and there's a little bit of stuff there, but overall I'm very happy. If you look at the rest of the cartilage around here, it still looks pristine.
Is that going to resolve itself, that?
Probably. It'll improve, but it depends a little bit on what happens with the biology of this area. So this is the side of the flap, this is the top of the flap here, more towards the front of the joint, and it comes right down here like this. Okay, and this is
that's 6 millimeters that we're looking at.
Width
there?
is across this way, and down this way it's more probably like 12, I suppose.
And that's the entire lesion.
Yes.
That we had.
So then we'll show you a little bit more of it. So there's a bit more of the flap here, and you can see those areas there. So it's sort of loose. It's starting to lift up. You can see that, and it's not adhered to the bone or stuck to the bone underneath it. If we look here, next one. Just looking here, looking at the front of the flap there, just trying to get a good eye view. A little bit of erosion, a little bit of loosening or fibrillation of the cartilage on the matching cup, but not bad. See what we got next. Okay, now I'm looking right over to the side of the joint, and this is part of the flap here, okay, and we're just getting elevated. This is an instrument in here, I'm holding it open, I'm just trying to get a better view up over